follow up on a call because right from the get-go, everyone should get an equal piece of the pie per se. And I emphasize to make sure the ethnic media ended up getting some funding for advertising about COVID. I will follow up on that.
Premier, my follow-up question is regarding emergency rental assistance announced by the Prime Minister. I have three questions. The first question is that TMI, which is very substantial part of the gross rent, is that included in this rent, in this assistance? And number two, most of the landlords are not willing to take that forgivable loan and put their 25% share. So that is why most of the businesses, they have got already notice.
What I understand, I'll confirm this with the finance minister, it's all inclusive. It wasn't before, now it is. So just to break it down, the landlord would pick up 25%, the tenant would take 25%, and the federal and provincial governments would pay the 50%. And it's over a $900 million plan, and hopefully they can work through this. But if we continue seeing the downward slope, hopefully we won't be in this position over the next few weeks, as long as we get approval from the Chief Medical Officer, our health team, and our Minister of Labor. I just want to keep emphasizing that, because I just don't want people thinking we're going to open up and we're all free to do what we want. It's just not going to be that way for a while. But hopefully we'll be able to get these stores opened up sooner than later.
Thank you.
We are taking you now to Quebec City. Quebec's premier and ministers are providing an update on COVID-19 in the province. Today, Quebec is reporting 75 more deaths and 758 new cases. The premier also just announced that they are delaying the planned reopening of businesses in the Montreal area. Let's listen.
As an everyday precaution.
The situation is still worrying in senior homes. We still need reinforcement. I'm asking Quebecers who can work full-time in residences to apply on the Je Contribue website. The great majority of hospitalization caused by coronavirus are currently happening in the Montreal region. This is why I'm announcing today that we're pushing back the reopening of non-essential businesses in the Montreal region to May 18. As for the elementary schools and childcare services, we still have 2 weeks ahead of us. We will follow the situation very closely and take a data-driven decision. We maintain the calendar for construction sites and factories, as well as non-essential businesses outside the Montreal region, but I'm asking business owners and clients to follow physical distanciation rules. We must continue our efforts. I'm counting on you all. Thank you.
Merci, Monsieur le Premier ministre. Alors, pour la période...
Thank you, Mr. Premier. We are now going to start the question period. Mr. Legault, Mr. Arruda, restaurant owners are probably going to be amongst the last to be able to deconfine their establishments, but they do want to get ready ahead of time for that reopening. What kind of measure could they set up, and when are you going to make an announcement? Maybe I can start by saying, unfortunately, that is a fact. Restaurants, the activities that regroup hundreds of people, shows, it's going to take some more time because it is more difficult to maintain a 2-meter distance. And on top of that, there's a difference when one is inside as opposed to being outside, so there's greater risk inside. I know that it's hard. We are going to be helping out people who are in the restaurant sector, in the hotel sector, in culture, generally speaking. When it is time to open, we'll try to help them financially, but it is true that in the short term, we're not planning on any reopening. And we will have principles of, social distancing, fewer clients within the restaurant, that kind of approach that we'll be able to do done. So we can't put the same people as before in this space. Of course, it's people who, who live together, they can be at the same table without being 2 meters away, but we have to use those elements. Maybe panels that could be placed between certain tables to avoid elements. Of course, hygiene is very important, not admitting anybody with symptoms, a series of measures that will be studied for this sector. And while I have the mic, I would like to pass a message about what I call the stress and anxiety and mental health problems. It is quite normal right now, after having been in a perspective where we tell people that the disease is dangerous and we saw that people are dying from it, to have emotions, to have stress and anxiety in relation to that. So not only mental health is exacerbated, but it's also a normal context within pandemic. The fear is there, we have to be able to manage it. So I would invite people, even parents who are asking themselves questions about whether they're going to send their kids back to school. There's a lot of questions. Don't hesitate to call the hotlines and to call the services that have been set up. This week there's a campaign on mental health. These are totally normal and legitimate reactions. Don't keep them just for yourself. Reach out. And I think that while following confinement, while asking people to respect things, we will be opening certain things to allow people who are alone and isolated, particularly our elderly, to be able to have a more normal life. It doesn't mean that we're going to start gathering tomorrow morning or having dinner over at grandma's, but we're going to try to loosen a little bit. We're going to try to lessen the constraints and allow people to have a little bit of hope. I think that it's really important for our elderly. So we'll follow that in the course of the next few days. Mr. Legault, we were able to read over the weekend in Le Devoir and other newspapers that your Minister for the Elderly rejects all responsibility for the situation of CHSLDs, and yet it doesn't come from yesterday. And she's been Minister since 2007. Is it because no one around Ms. Blaine, who was there before, listened to her? Or has she given you a portrait of the difficult situation in CHSLDs even before the crisis? Well, as I've often explained, when we got to power, and one of the reasons why Marguerite accepted to come with the CAC was because we had a plan to increase the funding amongst other places in CHSLDs, which is something that we did. But we realized that we couldn't even fill the positions. So we have to significantly increase the wages of orderlies. We are discussing with the FTQ and CSN. The discussions are going well. So that is the first thing that has to be done.
Bonjour, Monsieur le Premier Ministre.
Hello, Mr. Premier. Madam Minister, Mr. Arruda. Just a point of clarification, Mr. Legault, on what you said earlier on concerning teachers. You said that you were going to allow wearing a mask. There are teachers who are telling me it's one thing to allow it, but could we have that protective equipment? Up until now, they've been said no. There was even a teacher who told me we don't send soldiers off to war without them having weapons. And so it shouldn't be up to them, according to the teachers, to supply that equipment, even if they have the permission to wear it. Will there be safety equipment that will be made available to teachers? Well, listen, I think that the discussions that we are having right now seem to be along the lines that the Ministry for Education will be able to, if people want to have a face covering, exactly, they will be able to supply the material. It is being discussed right now, and it should be the case. So you'll be supplying that equipment. We also hear, Mr. Arruda, I mean, you talked about that last week, but there is an Australian study that says that children are not vectors of the disease, that they don't transmit, apparently. Shouldn't we then let them go see their grandparents if they are not vectors as such? Well, listen, together with everything that is called collective immunity, who transmit, who doesn't transmit, in the literature we have contradictory information. There are still people who are saying that the children can infect as much as grown-ups, others who seem to say the opposite. So in that concept, and once we have the confirmations, many controlled studies, and that are robust, we'll see what we do with it. In the short term, I would say that the recommendation is not that for the time being. We'll see how things unfold, and we'll also see how we'll be able to put them in contact, perhaps certain children with their grandparents at a certain distance for a short period of time, etc. That will be analyzed. But as I was saying, the data that are still controversial, one study comes out of one place, another study comes out of another place, and it's contradictory. We have to do epidemiological studies and analyses.
Madame McCann, Monsieur le Directeur national de la santé publique. Monsieur Legault, on le sait que ça...
Mr. Legault, we know that it's gone very quickly in the past 8 weeks. We learned today that the CHU had recovered the 45 million concerning the masks that never were delivered, except that there's somebody at the Ministry of Health who authorized renting a hotel that belongs to a director who has links with the mafia and is considered as being somebody who's done contraband. Is that normal, that kind of situation taking place, even if we are in a state of emergency? Well, I did ask a question this morning. What I was told is that usually there is, in fact, more verifications that are made. But now we are rechecking the situation, but it was to rent rooms at the Best Western Hotel. So we didn't think to, mistrust the owner to know whether they used to be with the mafia. It is worrisome to hear, so we're thinking about retightening the rules. You decided to delay the reopening of Montreal for business owners, except that we learned that there were roadblocks that was removed in the Laurentians, for example, in Bromont, and there are mayors who are very worried of the fact that people are going to leave the hot zones to go to the cold zones, and they don't want to see those people come. What do you have to say to people from Bromont and the Laurentians? Well, it's normal that when we start deconfining to allow certain businesses to function, that we remove certain measures. Those two things go together. However, and we repeat it, the guidelines, and I'd like to repeat it, it doesn't mean that everybody can start going to other places. I know that there's a great appetite for cottages and stuff, and we're monitoring things. We had allowed certain people to cross over, making sure that they were going to be in their own home, and not that they were going to be circulating, that they were bringing their own food. And usually it was, to move someplace that was more definite rather than going back and forth. So I think that we're going to keep an eye on things in the same way that we trust Quebecers for the question of social distancing, etc. When we start deconfining, well, we'll see. We're going to be following the situation. If there are problems that are reported, we'll be able to reevaluate with public safety what it may mean. And as I was saying once again, there's like a wind of freedom that comes with spring, and that comes with the deconfinement. But this is freedom that has to be, under dosage. We can't prevent all circulation within Quebec entirely. Hello. So the deconfinement today in Quebec is starting. There are places where barriers are removed and commercial activities are being taken up again, and that you are going to be keeping an eye on things to make sure that things don't degenerate. But the projections that you had given were until the 30th of April, the number of deaths, hospitalizations, and cases. Are you thinking of making new projections public? And if it's not the case, how are we going to have a reference point to know whether deconfinement is giving us the effects that we wanted, or whether we don't have to correct things? Well, first, there's always projections that are made, including for the month of May and the following months, on the INSPQ website. So there are different scenarios that are brought, pessimistic, optimistic. But what is important, and maybe it could complete the answer to Mr. Laforest's question, is to say in Montreal, the situation is stable. There is a little bit of leeway. So when we deconfine, we are thinking that maybe there will be an increase of cases, and we have a little bit of leeway. In regions, we have a lot of leeway. So the deconfinement is being done more in regions outside of Montreal because there's a lot of leeway on the number of available hospital beds. But in Montreal, for now, we are delaying the deconfinement because that leeway for us isn't great enough. However, the situation is stable, and there's beds for everyone. I would like to also add on that The situation in Montreal is also the fact that there are beds right now in the hospital sector that are occupied by people who no longer need the, technical, all the technical instruments. So they still have COVID-19, but we could be sending them like in buffer places like Hôtel Dieu, Hôtel du Puy, etc. But in fact, we would need more staff. We have the places, but we don't necessarily have the staff. So that is why the call of the Premier is important today, to help us once again to add staff, because that will allow us to free up more beds and have those people go to very safe places and to be able to see, and respond to other needs if there are further needs when we deconfine. And I would add on the question of M. Laforêt about the situation with the Best Western, that it is the CIS that is taking charge of all the care, the services at the hotel, so it is very safe for the patients. But as the Premier said, we have to review the situation. Concerning the number of cases, we can see the situation in Ontario where there were also problems in residences for the elderly. We can see that over the past few days, the number of active cases is decreasing. So there's more people on a daily basis that are being cured of COVID than people who are contracting it, whereas in Quebec, we're still on the increase in the number of active cases. What makes it that it's so difficult to reverse that trend, whereas our neighbors are managing to do so? Well, listen, first, we have to be prudent when we compare with Ontario. First, Ontario tests a lot less than we do. So, of course, the more you test, the more you find cases. And you'll see, when we increase by the end of the week to 14,000 tests per day, there will be more cases that will be added. So we have to be prudent with that. Secondly, our situation is very concentrated in CHSLDs. All deaths related to COVID-19 are declared in Quebec, and it is complicated to know how they are declared in Ontario. And as I was saying earlier on, it's very concentrated in the Montreal area. So when you look at the regions outside of Montreal, where we're starting to deconfine, well, there's quite a bit of leeway, and the situation is really under control when you look at the number of hospitalizations and even the number of cases. So it really depends on the number of tests. We do a lot more testing than in Ontario.
And you've been listening to the Premier of...
Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le Premier ministre, l'Honorable Blaine Higgs, et le médecin hygiéniste en chef, the Dr. Jennifer Russell. Before I call up the doctor, I'd just like to inform everyone that beginning today, our news conferences regarding COVID-19 will be held on Mondays, Wednesdays, and Fridays at 2:30. Avant qu'on commence, vous voulez noter qu'aujourd'hui, à commencer aujourd'hui, les conférences de presse portant sur le COVID-19 auront lieu les lundis, mercredis et vendredis, toujours à 14h30. Dr. Russell.
Merci, Bruce. Thank you. Good afternoon, everyone. Bon après-midi à tous. En fin de semaine, le Nouveau-Brunswick a franchi une étape importante. Il n'y a aucun cas actif de COVID-19 dans la province. Nous en sommes maintenant à notre troisième semaine sans qu'un nouveau cas ne soit signalé au Nouveau-Brunswick. Les 118 personnes qui ont contracté le COVID-19 sont maintenant rétablies de la maladie et heureusement, il n'y a eu aucun décès attribuable à ce virus jusqu'à présent. Il s'agit là d'une importante réalisation que peu d'administrations ont pu accomplir ailleurs dans le monde à ce stade-ci de cette pandémie mondiale. Au Nouveau-Brunswick, nous avons réussi à aplatir la courbe. Over this past weekend, New Brunswick reached a significant milestone: no active cases of COVID-19. We are now into our third week without a new case being reported in this province. All 118 confirmed cases of COVID-19 have now recovered from their illness, and thankfully we have no deaths to date. This is a significant achievement, matched by very few jurisdictions anywhere in the world at this stage of the global pandemic. We have flattened the curve in New Brunswick. Now it is time to look to recovery. With your good work, each and every one of you, we have earned the chance to get back to a new normal faster than most. The health of our population is about much more than a single disease, a single outbreak. Our health is also intimately linked to our economy, the ability to socialize with friends and neighbors, and the ability to do rewarding work. These are the things we now need to turn our attention to as a society. We need to continue to be vigilant to keep this virus at bay, but we need to find the balance between creating safe environments and allowing our businesses and public spaces to come back to life in a gradual, meaningful way. We have achieved a certain measure of success to date, and we can be proud of what we have accomplished. That is why I'm confident in our citizens and businesses as we head into recovery in the coming days and weeks. Each and every one of you, whether you are an entrepreneur, a business owner, an employee, a client, or a patient, all of us together, we need to be thinking about how we create these safe spaces and how we continue to be vigilant while getting back to our new normal. I, for one, am confident that we can apply the same amount of care and energy we had in fighting off the first wave of this disease and apply it to our recovery efforts. New Brunswickers have got this. We have what it takes to live with this virus. We now understand the importance of social distancing, hand hygiene, and masking when appropriate. And as I have told you before, there will be more cases of COVID-19 in New Brunswick in the months ahead. The difference now is that we are ready, more ready than ever. Our continued success will be measured by how we respond to new outbreaks when they happen. We now have the ability to quickly isolate new infections, track contacts to slow the spread of disease. We better understand how we treat those who become seriously ill while minimizing the risk to other patients and healthcare providers. We have to move mountains to protect the most vulnerable in our society, as well as those working hard to protect them. We will do all this well, so we can enable New Brunswickers to work, study, play, and generally live their lives every day within the context of our new normal. We will have to learn to live with COVID-19 until a vaccine or some other treatment is widely available. I am confident that you have the tools to do so. Je peux affirmer qu'il y aura d'autres cas de COVID-19 au Nouveau-Brunswick dans les mois qui suivront. Notre succès continu dépendra de la façon dont nous serons en mesure de réagir aux nouvelles éclosions lorsqu'elles se produiront. Nous avons maintenant la capacité d'isoler les nouvelles infections et d'effectuer la recherche des contacts pour ralentir la propagation de la maladie. Nous comprenons mieux comment traiter les personnes qui deviennent gravement malades, tout en minimisant les risques pour les autres patients et les fournisseurs de soins de santé. Nous devons déplacer des montagnes pour protéger les personnes les plus vulnérables de notre société et celles qui travaillent d'arrache-pied pour les protéger. Nous parviendrons à bien faire tout cela de manière à permettre aux gens de Nouveau-Brunswick de travailler, d'étudier, de jouer et, de façon générale, de reprendre leur vie quotidienne dans le contexte de notre nouvelle normalité. Nous devons apprendre à vivre avec COVID-19 jusqu'à ce qu'un vaccin ou un autre traitement soit largement disponible. Je suis convaincue que vous avez les outils nécessaires pour y parvenir. I believe this is possible because I have seen it over the last 2 months. New Brunswickers have quickly adapted to this new normal, and we have seen the benefits in your efforts. We cannot let our guard down. Even with our recent positive results, it does not mean that we cannot live our lives. As we gradually reduce restrictions on public movement, it will be very important that people adhere to public health advice and continuously monitor themselves and their families for the symptoms of COVID-19. And if you do have symptoms, please get tested, call 811 immediately and self-isolate. It is really important for us to keep our ability to finding cases as we move through the next phase. Now more than ever, any suspected case should be reported to Telecare 811 or your primary care provider, and their directions must be followed to the letter. Now more than ever, the cardinal rules for infection control must be followed. Limit your close contact to those in your 2-household bubble for now. Maintain 2 meters of physical distance between yourself and others when you do go out. Maintenez-vous à une distance d'au moins 2
Maintain a
mètres
distance of at
dès
least
lorsque
2
vous devez
meters
sortir.
from others when you
Dans
must
les
go
endroits
out.
où il est difficile
In
de
places
respecter les
where it's
consignes de
difficult
distanciation
to
physique,
respect
vous
the
devriez
physical
porter un masque
distancing
en tissu qui
restrictions,
vous couvre,
you should
qui
wear a
vous
mask
couvre le nez et la
that covers
bouche.
both your mouth
In the
and your
weeks ahead,
nose.
this might be required for you in some public spaces as more businesses and workplaces reopen. Wearing a mask will increasingly become a part of our daily lives in that situation. So take the time to get a mask for yourselves and your families and learn how to properly use them. Basic hygiene will continue to be your most effective weapon against the spread of COVID-19. Wash your hands regularly and thoroughly. Cough into your sleeve rather than your hands, and avoid touching your face. Clean commonly touched surfaces in your home, like doorknobs and countertops. These actions will slow the spread of the virus and save lives. Please keep doing all of these things. And it will continue to be important to take care of yourself mentally as well as physically. This is Mental Health Week in Canada, but looking after your mental health is important every week. We will all continue to experience stress, anxiety, and grief related to the pandemic, and it's okay to feel this way. This is part of our new normal, and please don't pretend these feelings aren't real. Reach out to others to share your feelings, and remember that help is available whenever you need it. Il continuera d'être important de prendre soin de soi, tant au point de vue mental que physique. C'est la semaine de la santé mentale au Canada cette semaine. Mais il est important de prendre soin de sa santé mentale tous les jours de l'année. Nous continuerons tous à ressentir le stress, de l'anxiété et du stress du chagrin en raison de la pandémie. Vous avez le droit de ressentir ces sentiments. Cela fait partie de notre nouvelle normalité. Veuillez toutefois ne pas prétendre que vous ne ressentez pas vraiment ces sentiments. Faites appel aux autres pour partager vos sentiments et n'oubliez pas que des services de soutien sont à votre disposition si vous avez besoin de l'aide. It is my hope that we can continue moving forward with a gradual and cautious reopening of our province. But because the virus remains very active in most of the provinces and states that surround us, we will have to maintain controls at our borders. The requirement for 2 weeks of self-isolation by those arriving in the province remains in effect and is extremely critical at this point in time as we start opening things up in the future days and weeks ahead. We will have to restrict movement in and out of the province in order to slow the spread of the disease. It is how we can reopen more quickly, by minimizing the risk coming from other provinces or countries where the disease is more prevalent. But we can't completely isolate ourselves forever. We can't hide from the impact of this global pandemic, and we certainly can't afford to be smug about our current good fortune. We have to learn to live with COVID-19 and be prepared for whatever comes next. The new normal will not seem normal based on our pre-pandemic experience. Life has changed. We will have to do things differently for the foreseeable future, and it is by your hard work that we have reached this milestone today. I am asking that you continue to make sacrifices, be vigilant, and care for yourselves and others as we work through this. We have come a long way. We still have a long way to go. The rainbow that we see in windows across the province is not too far away now. I am convinced that we can get there together. Nous avons fait d'énormes progrès, mais nous en avons encore beaucoup à faire. Je suis cependant convaincue que nous pouvons y arriver en travaillant ensemble. Merci.
Thank you very much.
Bonjour, good afternoon. Before I begin today, I want to recognize that there were a number of lives lost and people seriously injured in New Brunswick over this past weekend. Emergency first responders and the police were answering calls throughout the province on several incidents. My thoughts are with each of the families who have been impacted by these terrible events. Today, we mark 16 days of no new cases of COVID-19. We also learned on Saturday that all 118 people who were confirmed to have the virus have made a full recovery. This is a major achievement for our province. Je suis reconnaissant envers toutes les
very
personnes,
grateful to
les
all of those
travailleurs de
people,
première ligne,
our
les
frontline
employés
workers
essentiels
and
et
essential
tous les gens
workers
de Nouveau-Brunswick
and all
qui
New
ont contribué
Brunswickers
à notre réussite
who
jusqu'à
have
maintenant.
contributed to our success thus
Mais je veux
far.
vous appeler à la prudence.
But I
Nous
want
avons
to ask you
remporté
to be
cette première
cautious.
bataille importante.
We have
Mais
come through
cela
this
ne veut
first
pas dire
battle,
que nous avons
but that does
gagné
not
la
mean
guerre.
that we have won the war.
We currently do not have any confirmed cases of the virus in New Brunswick, but we can and should expect to see more in the future. We need to be prepared to react quickly and manage the situation effectively when we do have more cases. Our province continues to be surrounded by COVID-19. Alors que nous continuons à aller de l'avant
As we
avec notre
continue
plan
to
de
move
rétablissement,
forward with our
nous
recovery
devrons
plan,
trouver un équilibre
we will
entre
have to
retrouver
find the
une
right
nouvelle
balance
routine et
between a
protéger
new
la santé
routine
de nos
and protecting
résidents.
the health of our residents.
I know many New Brunswick business owners are eager to start reopening, and this week we will be providing more details on exactly what that means. Je sais qu'il y a plusieurs propriétaires
I know that there are a
d'entreprises
number
de
of
Brunswick
business
qui ont
owners
hâte
here in New
de
Brunswick
relancer leur
that
activité.
are anxious to
Cette semaine,
restart
nous
their
offrirons
business.
plus de détails,
This week, we will be
détails
providing
sur ce
additional
qui
details
cela signifie.
as to what that will mean for them.
Businesses will start to reopen, and we will return to some sense of normalcy in the near future. But this new normalcy will be different. New Brunswick business owners have always been innovative, and I know they will continue to explore new ways of doing things in the face of this pandemic. More restrictions will loosen this week, and I know businesses will be eager to open their doors. We need to make sure we handle the reopening process in the very best way possible, because we do not want to step backwards in this fight on COVID. La semaine dernière, nous avons annoncé
Last
que les
week,
travailleurs
we announced
étrangers temporaires
that
n'auront pas la permission
foreign temporary
d'entrer
workers
dans la
will
province en
not be
raison
allowed
de
to enter the
préoccupations
province
sérieuses
because of serious
entourant les
concerns
répercussions
with
possibles
respect
sur
to
la santé
possible
des gens de Nouveau-Brunswick.
repercussions on the health of New
Je sais que
Brunswickers.
cette décision
I
a
know
créé
that decision
des inquiétudes
has
chez
created
certaines
concern
entreprises,
among some
notamment
businesses,
dans le secteur de
particularly in
de
the agricultural industry,
et entreprises demandant
and
comment elles vont trouver des travailleurs.
these industries are wondering
Today,
where
we
they're
have
going to
launched
find
a virtual
workers.
job matching platform called Job Match NB to connect New Brunswickers with available positions. I want to encourage employers and job seekers to visit the site at gnb.ca/workingnb. Employers can add available job opportunities into the system, and these jobs will appear on the site within a few days. We need New Brunswickers to step up for our New Brunswick to fill these positions. By stepping up, you will be playing an important role in helping your community and our province's economy. As more people start to return to work in the weeks and months to come, I know many parents are concerned about having access to safe childcare. I want to assure you that the Department of Education and Early Childhood Development is working closely with early learning and childcare operators to ensure parents will have access to childcare services once we move into different phases of recovery. Lorsque les employants de gardiens et
When
de centres
employees
de la petite
of
enfance commenceront à relancer leurs activités,
daycare centers
ils devront
begin their
avoir
activities
des
again,
mesures de sécurité en
they
place,
will have to
selon
have
le
security
Conseil
measures
de
in
la
place
santé publique.
based on advice from the Public Health Department.
Everyone must continue to follow the state of emergency, the order that is still in place. Law enforcement officials are continuing to respond to reports they receive about violations or noncompliance. Whenever possible, they are focusing on educating people and making sure they understand what the rules are. Je sais que la plupart des gens de New
I
Brunswick
know that most New
suivent
Brunswickers
les règles,
are following the
et je
rules,
suis persuadé qu'ils
and
continueront
I'm
de le faire.
convinced that they will continue to do
Si nous
so.
voulons continuer à avancer,
If we want
faire la
to
reprise
continue
des
to
activités
move
dans
forward
notre
towards
province,
the
nous
recovery
devrons
in this province,
soumettre la peine à la patte.
We will all have to
With everyone's
contribute.
cooperation, I know our province will continue to lead the way in the fight against this virus. And we will not only be in a position to continue our recovery, but to start up effectively and efficiently and to move people back into their new norm, which will once again get New Brunswick back on the road to recovery. Thank you. Merci.
Merci, Monsieur le Premier Ministre et Dr. Jennifer Russell. Thank you, Dr. Russell. Premier Higgs. We will now proceed with questions from the media. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, what can you tell us about how antibody testing is being implemented internationally at this stage in the pandemic? Are there any countries that are leading the way, and are there any new developments in Canada to implement a national antibody testing strategy in the future?
So the last conversation, the last meeting that we had with the Special Advisory Committee at the national level did focus actually on that topic. And at this time, here in Canada anyway, we're not advanced enough to be able to say that we're going to move in that direction right now. But definitely as time goes on, that would definitely be something that we could introduce when we have the right evidence and the right information around that. But for right now, our testing capacity is limited to testing those people who currently have the disease. But the longer term plan is to incorporate that into our testing strategies for the reasons of looking at the immunity. So there's actually a task force dedicated to this. It's called I forget the exact name, but at the national level, it's a task force on immunity to work specifically on this at the national level, and they will collaborate with each province and territory across the country.
Thank you, Doctor. Ms. Hogarth, do you have a follow-up today?
I do. Thank you, Bruce. It's also for Dr. Russell. Dr. Russell, many galleries and museums are wondering when they will be allowed to open, since they can limit the number of people allowed in at one time, and there's no merchandise that's meant to be touched by visitors. Have there been any decisions made with regards to gallery and museum opening?
So all of the information in terms of what's happening with the next phase has to go to the COVID-19 cabinet as well as regular cabinet. So all of those decisions will be made then, and then we'll be able to make a public announcement about them.
Thank you, Doctor.
Thank you.
Ms. Hogarth. Elizabeth Fraser, CBC.
Hi there. My question is for the Premier. The incidence of alleged homicides and violence over the weekend seemed especially stunning because after 6 weeks of staying at home, we had just received the news that we have had no cases of COVID-19. Do you think the uptick in crime has anything to do with the stress of this disease or the way people have been forced to live under the state of emergency? And have you asked your government to explore this possibility?
We certainly are asking for a report from the police officials and public safety as the investigations are underway, and then we'll learn more. We met with the RCMP and public safety about 2 to 3 weeks ago to understand, what the impacts of the restrictions around COVID-19 were having on the public and what we were seeing throughout New Brunswick. And at that time, we also were looking at, any changes, any trends, and also, I know Dr. Russell has made it in several occasions during these presentations about we saw also a reduction in usage in transition homes and houses that were available, just not unlike what we've seen in emergency rooms and hospitals, and a reduction in usage. So it was stressed here in these press releases. I know Dr. Russell stressed there on numerous occasions that these facilities were still available. So we wanted to make sure people knew that we were providing help and assistance wherever we could, and that was continuing. So I can't preclude or make any prejudgment on this particular rash of incidents this weekend, but I'm certainly very anxious to hear the police reports and investigations and to understand what else could be done in any situation to avoid any future incidents.
Thank you, Premier. Ms. Fraser, do you have a follow-up this afternoon?
Yes, I have another question for the Premier. Now that we have no active cases, it does seem as if travel across our borders will be the only way that the disease can come here. Where are you most concerned that your border precautions might not be enough? And how exactly and how closely are you following the people who do get through?
So on the first count, I guess it's, if you look around us and the bordering provinces or states and the levels of situation they're currently in with the COVID pandemic, that would give you a sense of certainly where our biggest concerns might be. However, you know, I've asked for a detailed breakdown of kind of the travelers coming across our borders. For what reason? What are the ones we've contacted? Are we contacting everyone who's returning? Let's say who returned back. We are really going to focus on borders, and so that information is being prepared, so we'll be able to make the right judgments on who needs to come in or through New Brunswick and who doesn't, because it is clear that our risk is at our borders, and that is an area that Dr. Russell certainly reemphasized in many occasions. I feel the exact same way, and we will be strengthening control around our borders as necessary to minimize the risk for citizens of this province.
Thank you, Premier. Thank you, Ms. Fraser. Michel Corriveau, Radio-Canada.
Oui, bonjour, merci, Bruce. J'aurais une première question là, pour Dr. Russell qui revient un peu sur la question qui a été posée par Mme Fraser. Il y a eu quelques cas de violence envers les femmes ces derniers jours à Hillsborough, samedi et Gagetown. Est-ce que les mesures de confinement font craindre pour la sécurité des femmes?
Alors, on sait que durant la pandémie, quand on avait des mesures en place que la santé mentale de tout le monde pourrait être affectée, on a entendu dans d'autres provinces ils ont vu une augmentation dans les cas de violence domestique. Nous, pour le temps en total qu'on est dans les mesures de sécurité ici, on avait des places en des établissements pour recevoir des victimes et on n'avait pas vu que les nombres ont augmenté là. Et alors, on sait que c'est possible que la situation peut causer des problèmes sévères dans cette situation, mais on n'avait pas vu ça durant la pandémie jusqu'à la fin de semaine.
Merci, docteur. Monsieur Corriveau, as-tu un suivi?
Oui, Bruce. Et j'ai une question pour Monsieur le Premier ministre, Monsieur Higgs. Alors, Monsieur Higgs, à Campbellton, dans le nord de la province, à la frontière avec le Québec, des agents de la paix ont empêché des Québécois de Pointe-à-la-Croix, qui est juste de l'autre côté, de se rendre au Superstore pour y faire l'épicerie. Des agents ont suivi des gens qui sont allés à la pharmacie. Ils les ont suivis en auto pour s'assurer, par exemple, qu'ils vont à la pharmacie et qu'ils reviennent. Il y a une dame qui a été mise en état d'arrestation pour avoir voulu aller au Superstore. Elle y était pourtant déjà allée dans les semaines auparavant. C'était la première fois qu'elle était dans une situation comme celle-là où on l'empêchait. Pourquoi les consignes changent si souvent à la frontière, à cette frontière-là en particulier?
So nothing has changed in relation to the rule requirements for that crossing. They're essential services, people that were coming to get groceries, coming to the drugstore, they've been in place, since the beginning. I'm actually, when I hear that, our security officers are following to ensure that people that are actually doing what they say they will do, it only adds to the security of our province. And I don't know, I can't speak to the particulars of this case, but, if someone is coming maybe several times during the day, you might start to wonder or ask additional questions, is that necessary? So without knowing the details here, particularly, I feel that our safety compliance officers and our folks that are staffing the borders and questioning entrants coming in have been doing a magnificent job. And I know that it's not always easy when people are questioned about what they at one time was a routine and a daily activity, but it's really important now. It's important that we don't lose sight, and we've said here earlier about how important our borders are, and it is the difference for us, and we got to maintain that rigidity. And as we open up and start to move more freely and have more activity in our province, it's going to become even more critical, because if we're moving ahead quicker than other provinces, more people will want to try to get into New Brunswick, and we just got to be diligent. So I ask for people's patience and understanding, and I once again, I commend our safety compliance officers for doing the job that they've been asked to do.
Thank you, Premier. Monsieur Corriveau, Dr. Russell va aller au podium maintenant pour parler de ta question de vendredi dernier concernant le Kawasaki.
Oui, Monsieur Corriveau, vous m'avez demandé une question au sujet de la maladie Kawasaki. Et vous m'avez demandé si on avait vu des cas ici au Nouveau-Brunswick associés avec le COVID-19 dans les enfants. Et quand que j'ai fait des recherches, je crois qu'on avait seulement eu 8 cas de COVID-19 dans des enfants moins âgés de 19 ans. Et l'autre recherche que j'ai faite, c'est sur le sujet de la maladie Kawasaki associée avec le COVID-19. C'était rapporté dans les États-Unis une couple de journées avant qu'ils voyons des cas comme ça dans les États-Unis. Mais ici au Nouveau-Brunswick, on n'avait pas vu ça. Mais sauf qu'une couple de journées avant que vous m'avez demandé cette question, on avait eu des rapports de la possibilité d'avoir des problèmes avec des doigts et des orteils bleus ou violettes. Alors ça, on avait annoncé une couple de journées avant et on a mis les critères, on avait changé nos critères pour être testés pour les enfants pour les gens à 811.
Merci, Docteur. Merci, Monsieur Corriveau. Andrew Watt, Telegraph Journal.
Hi, questions for the Premier. Premier, Minister Carty was on the radio this morning talking about how every child in school who needs some sort of technological device in order to continue online learning will get one. Can you give us the details of that program, how much it's going to cost, how many kids are going to need them, that kind of stuff, please?
No, I can't give you the details. I think they're coming later this week, but I think it falls in line with what we've been saying all along, that we will be ready to resume our educational plan, and that's been the mandate certainly the Minister of Education has been given in the fall. Whether we are still in a COVID crisis or whether we're not, we want our kids to continue their education, and if that's through a complete e-learning experience, we know that every child needs the capability and the equipment to do that. But we're just moving forward. You know, we're going to be prepared to keep this province moving in a way, and education's always been a primary goal.
Thank you, Premier. Mr. Watt, do you have a follow-up today?
I do. Again to the Premier. Premier, so we're 16 days in a row with no cases. Has there been any thought to accelerating the phases, or are you staying on track?
Well, I guess in case of, and you probably want to ask Dr. Russell and myself this question, but if you recall that our phases were basically laid out in a 2 to 4 week program, and to your point that we've had a record that I guess couldn't be better at this point with no cases in the last 16 days, and all cases now fully recovered. So it does, and a lot of the debate, a lot of discussion right now is around, okay, at what levels can we open, what can we do differently, and can we move anything forward? So those discussions are underway. I made a reference in my press release that further information in that regard and details will be forthcoming this week. So I just want to leave it to the point, Andrew, that yes, we recognize there's an opportunity to move forward and accelerate some of the situations, but on the schedule of recovery that we can feel confident in and that public health can feel confidence in. And also, it reinforces the comment I made earlier about our border security, because that is truly going to be the difference for us. It's going to be, you know, working within New Brunswick by New Brunswickers wherever possible. I know that can't be fully and completely, but wherever possible, and that we can recover and not regress. So the opportunity is in front of us, and you'll learn more about that as in the coming days.
Thank you, Premier. Thank you, Mr. Waugh. Mike Cameron, CTV.
Thanks, Bruce. This is for Dr. Russell. There have been some jurisdictions in the states are going to be conducting random testing as a means of determining how many people in the population are asymptomatic. Are we considering any move like that in New Brunswick, conducting random testing?
Yeah, so we have some of our public health team meet on a regular basis, as well as with the task force, to talk about testing and what direction is coming next in terms of the steps. The ultimate goal, obviously, is to find cases, keep our testing numbers high enough to be confident in the data. So we have to maintain a minimum number of tests per week. And obviously, if people have symptoms and we're testing those people, great. We really encourage everybody in the province who has symptoms to call 811 and get tested. And then separate from that, we do have a couple of plans that are probably going to be forthcoming in the next few days around asymptomatic testing. But it would be very, very specific situations and circumstances. And again, as we finalize those decisions, I can announce those things. But just to know that it is part of our plan moving forward for some types of asymptomatic testing.
Thank you, Doctor. Mr. Cameron, do you have a follow-up today?
Yes, I guess for Dr. Russell then. Not to jump the gun then, Dr. Russell, I understand you've got an announcement to make in a few days, but I'm just wondering what kind of form could random testing actually occur in New Brunswick? And secondly, do we have the resources and the tests available to actually conduct some form of random testing? Thank you.
That's a great question. So the balance between keeping the numbers high enough for the data to be meaningful has to obviously be balanced with how many tests do we have to be able to augment those numbers, knowing that if there was an outbreak that we would have to make sure that we had enough testing kits for that purpose. So these are all things that are definitely taken into consideration as we have these conversations.
Thank you, Doctor. Thank you, Mr. Cameron. NTR Huddle today.
Hi, yes. The first question is for Dr. Russell. In the government-based plan, it says that businesses that can ensure physical distancing can open with strict controls at this phase. So I was wondering if businesses like retail shops and restaurants and meeting rooms can follow proper guidelines, why can't they open now? And is there an opening date set for those businesses as well?
So the whole phased approach for opening the economy and society is based on principles and guidance provided from the Public Health Agency of Canada. It is also a roadmap for doing our own risk assessments within each jurisdiction based on our own epidemiology, that is to say, our case numbers, transmission patterns, et cetera. So these decisions were taken into account, these pieces of information were taken into account when we did our own risk assessments here in New Brunswick with the help of our epidemiologists who are the specialists in looking at this kind of data. So with all of that information, it wouldn't really be something at this point in time that we would need to go through prior to what COVID cabinet is being presented with, because all of this information in terms of the next phase, we are preparing the guidance documents and we have to communicate all of those details. And so as of right now, everything that needs to be done is being done to get to the next phase. And I wouldn't necessarily say that there was a need to rush that. We've been preparing all of the documents and all of the information that we need for preparing for that next phase. So, and again, we're going to be presenting that to Cabinet, and then decisions will be made and finalized, and then we can make those announcements.
Thank you. Do you have a follow-up this afternoon?
I do. I was just wondering, I do have a follow-up, but I was just wondering if the Premier could also address that question.
Can you please repeat that original question then?
Yes, sorry. With the phase plan, if businesses like retail shops and restaurants, dining rooms can follow proper guidelines, why can't they open now, and is there an opening date set for those businesses?
So, not as I had indicated earlier about, and when I was asked about the track record to date and the ability to open sooner, and looking at the 2 to 4 weeks, and we're obviously on the 2 weekend. 2 weeks is Friday, the May 8th. And so I guess as we're working through what can open and how we can move forward, and we're working through that with public health, and and obviously understanding the business communities. But we're also working with that with WorkSafe New Brunswick, so we can be in a position of advising businesses on their startup requirements. The information is readily available, so I would suggest to businesses who are looking at obviously getting back in business, they should be looking at our website, looking at the public health requirements, and see how it fits their model. So in short, I would say every business should be looking at how they can adapt to the public health requirements, because that'll be the ongoing request. And there will be changes coming this week that Dr. Russell and I will be bringing forward here because we are in the 2 weekend, and that is making the assumption that our situation continues as it has been over the last 16 days.
Do you have your quickest follow-up?
Yes, Premier, with regards to temporary foreign workers, farmers said that there's a lack of understanding about the complexity and the level of knowledge that's required for agricultural work. Are you confident that we can find and train the workers that we have here in New Brunswick, given those concerns?
You know, I appreciate the concerns by the farming community and the, and the processors and really any activity or company that is used to bringing in the maybe trained farm workers, the same ones that have been coming for many, many years. What I'm asking is we need their help right now. We've said it over and over about how important it is for us to protect our borders, and I would assume that the issue in BC last Friday with temporary foreign workers, and 4 arrived with impacted by the virus. You know, we don't need to take that risk if we have other options, and I've outlined the capability of the numbers of people potentially, but you're right, they won't all be suited or able or skilled to do the jobs that are right there, but some of them I'm sure will be. And I'm just asking farmers and others to say, you know, I know this is not what the norm would be. I know this is going to be more difficult for me to get my crops in or to do my business, but I can do my part too. I can train these individuals. I can, use a couple more people than I might normally, and it'll be an experience for all of us. And, through this process, I would like to spend some time on a farm. So we'll see where that goes. And I don't know if anyone would volunteer to take me or not, but, I'm a country boy at heart, no stranger to a tractor. And so I just think that we all have to do our part. And stepping up for New Brunswick does not provide any barriers for anyone who's willing to do so.
Thank you, Premier. Thank you, Ms. Intihar. Silas Brown, Global.
Hi, Premier. I've heard from some people in Pointe-du-Chêne today who say that the community and Parley Beach saw a large influx of visitors over the weekend, and there's concerns about people coming from outside the area to access the beach and the town there. Is that a concern for you? People traveling from across the province to go to different communities and that sort of thing, or are we at the stage of recovery now in the province where you don't believe that is so much of an issue?
Well, it's an interesting situation, isn't it? Because here we're trying to protect our borders so people in New Brunswick can feel like they can move around in our own province and do so safely, all the while, again, following the public health requirements. And a while ago, we had that issue in different communities, and now we feel like, okay, people can move around the province, but we need to protect our borders. And I mean, that's been the whole discussion around the temporary foreign workers. It's not about it's going to be inconvenient, it's about how do we minimize our risk. So I think that we're going to really focus on the ability for people in our province to move around New Brunswick and see New Brunswick and do it in a respectful way that meets the health requirements. And we can do that a whole lot more safely if we continue to tighten and secure our borders. And that's the challenge we have. We said a few weeks or last week in different sessions that we want to open up spaces. I mean, that does include beaches and parks, and we expect people to follow the rules and even doing so. But the stronger we are at protecting our borders, the more people are going to feel comfortable with new people coming into their community. And these new people are other fellow New Brunswickers that are coming to enjoy what we have here and the great outdoors that we have. And once again, have a whole renewed faith in our province and a whole renewed initiative of just how good we can be. That's what I think is going to come out of this COVID recovery plan, is all of a sudden people are going to stay home and staycation in New Brunswick, and we want people to feel safe when they see new cars driving through their street, and we want those cars to have New Brunswick plates on them.
Thank you, Premier. Mr. Brown, do you have a follow-up today?
Yeah, this is for either the Premier or Dr. Russell. As people are looking at doing this and driving around to potentially access different areas of the province, what are the things that they need to keep in mind to do this respectfully and to do this safely?
Well, all of the things that we've been promoting up until this time in terms of public health information and advice around hand hygiene, social distancing, wearing a face mask if you can't social distance, if you're in a situation where you can't, and also making sure you keep all the surfaces clean. If you're driving around the province, obviously as the Premier said, we are hoping that people are not going too far away from their neighborhoods, but and are going out to do essential things. But certainly, as measures are relaxed and people are more comfortable going on outings, again, it's doing it as safely as possible with all of the advice that we've given thus far.
Thank you, Doctor. Thank you, Mr. Brown. Mathieu Bois-Comeau, l'Acadie Nouvelle.
Bonjour, ma question est pour Dr. Russell. On a beaucoup parlé de ce qui pourrait s'en venir pour les entreprises dans les prochains jours. Qu'est-ce qu'on peut s'attendre pour le public en général et pour les familles en prévision de vendredi, ou est-ce que ça fera officiellement 2 semaines qu'on est dans la première phase et qu'on pourra peut-être entrer dans la deuxième phase? Qu'est-ce qui attend les familles et les individus?
Alors, parce qu'on va faire des annonces plus tard dans la semaine, c'est des décisions qui vont être faites au cabinet. Alors, il faut attendre que les décisions soient finalisées avant qu'on peut faire des annoncements sur ces sujets.
Merci, docteur. Monsieur Roy, comment as-tu un suivi?
Je comprends que vous ne pouvez pas annoncer ce qui va être annoncé avant que l'annonce soit faite officiellement et puis que la décision soit prise au cabinet. Mais quand on regarde, pouvez-vous nous parler de la phase 2, quand on regarde le plan qui était déjà prévu, ce qui a été déjà rendu public, ça pourrait avoir l'air de quoi? Je vois dans le plan que, par exemple, quand on parle de rassemblement avec distanciation physique, on parle de 10 ou moins dans la prochaine étape, des choses comme ça.
Alors ça, c'est le plan qui a été présenté plusieurs semaines passées, et au fur et à mesure que on a des nouvelles informations, on peut ajuster notre plan avec cette information-là. C'est pour ça que je ne veux pas vraiment parler trop de ce sujet, parce qu'on travaille avec nos partenaires pour vraiment finaliser tous les détails, les présenter au cabinet, et après ça, on peut les communiquer.
Merci, docteur. Merci, M. Roy-Comeau. Mia Urquhart, CBC.
Thank you, Bruce. My questions are from the Premier. Can you tell us how you see the next phase unfolding, especially how you'll keep track of the strict controls companies have adopted while also enforcing the social distancing and mask requirements?
You know, it's a good question, because the more that the society opens up, which I absolutely believe needs to happen, and we work to getting to a new norm, the more difficult it becomes to actually monitor and control every aspect of what we do, and that's not our goal. Our goal is to appeal to the citizens of the province to not set us back, not think you're fooling somebody if you can load your car full of people or pick up a group of hitchhikers and think, well, they didn't catch me. This isn't about avoiding a speeding ticket. This is about avoiding a health risk. And so if we will be monitoring, WorkSafe will be visiting businesses. There will be ongoing compliance checks, and in popular spots particularly, we met talking earlier about Parley Beach and things like that. But at the end of the day, if the people of the province do not engage in a way that's meaningful to ensure that our public health rules are followed, we could regress. Right now, New Brunswick is in a great position. We're being noticed nationally because of the position we're in, and I give full kudos to so many people, not only from the early engagement, but to the public health, Department of Health, first line, healthcare workers, first line workers in any category that have been essential services. Truck drivers, you can go on and on and on. And then the average citizen that have followed the rules. We're just asking, let's open our society up. Let's make New Brunswick once again a province that we can move around, enjoy the province to its utmost. But let's do it while all in the same time having in the back of our mind, there's a health risk that hasn't been solved yet. I don't want to add to that.
Thank you, Premier. Ms. Urquhart, do you have a follow-up this afternoon?
I do, thank you. Is it true that you will allow some bars to reopen in the next phase? And how will you decide whether to make that call?
Well, Dr. Russell may have an answer for that, but I don't think that's true. No, she has nothing more to add to that. We're in full agreement.
Thank you, Premier. Thank you, Ms. Urquhart. Nicolas Steinbach, Radio-Canada.
Bonjour, Monsieur le Premier ministre. Bonjour, Dr. Russell. Cette question est pour Dr. Russell. Docteur, avec 0 cas de COVID-19 au Nouveau-Brunswick, on reçoit beaucoup de messages concernant l'usage de la chloroquine, hydroxychloroquine, plaquenil. Est-ce que le Nouveau-Brunswick a utilisé la chloroquine plus qu'ailleurs au Canada comme médicament contre la COVID-19 et est-ce que ça a contribué à la guérison des 118 cas?
Moi, je n'ai pas reçu d'informations que ça a été utilisé ici au Nouveau-Brunswick. Les seules informations que j'avais reçues, c'était il y avait une idée d'avoir des recherches au Canada et la préservation de les produits pour ceux qui ont des maladies que ce médicament est requis pour leur traiter devrait être protégé pour ces gens-là. Ça, c'est les seules informations que j'avais reçues.
Merci, docteur. M. Steinbeck, as-tu un suivi cet après-midi?
Oui, merci Bruce. Toujours pour Dr. Russell. Concernant les tests cliniques ou les études observationnelles du CHU du Mont sur la chloroquine, savez-vous si ça a débuté et êtes-vous au courant si des consignes ont été données par votre bureau ou par les réseaux pour ne pas aller de l'avant avec ces études cliniques au CHU du Mont concernant la chloroquine?
Comme je vous dis, les seules informations que j'ai reçues, c'était il y avait des plans pour faire des recherches, mais je sais pas au courant s'il y avait des recherches qui ont été faites, sauf qu'il y avait des plans pour le faire, puis si ça allait être fait, il faut que ça soit avec des produits qui sont pas ceux qui sont réservés pour les gens qui ont des maladies qui ont besoin de ce médicament pour leur traitement.
Merci, docteur. Merci. Thank you, everyone. That concludes today's update. Just